the world's population is more than 3 times larger than it was in the mid-20th century. It is expected to increase by nearly 2 billion persons in the next 30 years, from the current 8 billion to 9.7 billion in 2050, and could peak at nearly 10.4 billion in the mid-2080s. One of the factors that influencing the population growth in the world is fertility rates. Future population growth is highly dependent on the path that future fertility will take. According to the World Population Prospects in 2022 revision, global fertility is projected to fall from 2.3 children per woman in 2021 to 2.1 in 2050.
What's up, guys?
Today we're talking about contraceptive measures.
First of all, what is contraceptive measures? Contraceptive measures are methods or devices used to prevent pregnancy.
Here are some types of common contraceptive measures. First is the hormonal methods. A hormonal contraception is a method of birth control involving steroids hormones with the selective estrogen receptors modulator being marketed in India.
First off, birth control pills or oral contraceptive pill is a combination of estrogen progestin or progestin only. It contains hormones that blocks the release of the eggs from the ovum.
Contraceptive patch. The contraceptive patch is a small, sticky patch that releases hormones to prevent pregnancy. It's worn on the skin for a week, then replaced with a new patch. It may have some side effects like nausea, dizziness, and etc. Third, the vaginal ring is a monthly inserted ring. It releases that hormones estrogen, the progestin, to your vaginal lining to prevent pregnancy.
Depo-Provera. Depo-Provera is a well-known brand name for hydroxyprogesterone acetate, a contraceptive injection that contains the hormone progestin. Depo-Provera is given as an injection every 3 months. Depo-Provera typically suppresses ovulation, keeping your ovaries from releasing eggs.
Lastly, the implantable contraceptive hormones releasing rods, also known as a birth control implant, is a small flexible plastic tube that doctor put under the skin of the upper arms. The tube releases hormones that can help protect against pregnancy for up to 3 years. The risks of hormonal contraception. Hormonal contraception can raise the risk of blood clots and breast cancer. The risk is very low, but it means some hormonal contraception is not suitable for everybody. To ensure safety, contact a doctor, nurse, sexual health clinic, or pharmacist to find out more about the risk of hormonal contraception.
Barrier methods. What are barrier methods of birth control? Barrier methods of birth control acts as a barrier to keep sperm from reaching the egg. Some barrier methods also protect against sexually transmitted infection. A few barrier methods, spermicide and condoms, can be bought in most drugstore. Others, diaphragm and cervical cap, must be prescribed by a healthcare professional.
The first types of barrier method is spermicide. A spermicide is a chemical that inactivates sperm. Most spermicide in the United States contain a chemical called nonoxynol 9. Spermicide can be used alone with all other barrier methods. How do you use spermicide? Spermicide is a medication used to treat sex in the vagina. Inserted close to the cervix, it comes in various forms, including foam, cream or gel, suppositories, and film. The applicator is usually a tampon, and the spermicide is effectively for 1 hour. If the spermicide is not used with this time, it must be reinserted for each act of sex. What are the possible risks and side effects of spermicide? Spermicide can cause vaginal burning and irritation. Some people are allergic to spermicide and maybe have a reaction.
The second barrier method is condom. A condom acts as a physical barrier that prevents sperm from entering the uterus and reaching an egg. There are 2 types of condoms. The external or male condom is a thin sheet made of latex or rubber
Polyurethane, plastic or natural animal membrane that is worn over the erect penis during sex. Latex and polyurethane condoms provide the best protection against many STIs, including HIV. The second is the internal female or female condom. It's a thin plastic pouch that lines the vagina. It is held in place by a closed inner ring at the cervix and an outer ring at the opening of the vagina. It provides some protection against STIs. Spermicide should be put into the vagina, not on the condom. Some condoms are sold already coated with spermicide, but it is only a small amount. They may not be any better in preventing pregnancy than a condom used without spermicide. Possible side effects or risks. Some people are allergic to latex or polyurethane and may have a reaction.
Third is sponge. The sponge is a round device that made of soft foam that contains spermicide. It is inserted into the vagina to cover the cervix and keep the sperm from entering the uterus. The spermicide also inactivates sperm. The sponge does not protect against STIs, including HIV. You should use condom in addition to the sponge for protection against STIs. The sponge is less effective in women who have given birth. If you want to use the sponge after having a baby, you should wait 3 weeks after giving birth until the uterus and cervix have returned to their normal size. What are the possible risks and side effects? The sponge contains spermicide, which increases the risk of HIV infection from infected partners. It may cause vaginal burning and irritation, and some may have allergies. Toxic shock syndrome is rare, but has occurred in a few women. Use only with a one-sex partner and low HIV risk. Avoid wearing the sponge for more than 30 hours.
The fourth types of barrier methods is diaphragm. The diaphragm is a small dome-shaped device made of silicone or latex that fits inside the vagina and covers the cervix. It must be used with spermicide. There are two types of diaphragms. Both diaphragms are available with prescription only.
Individually sized diaphragm, which must be fitted by health care professionals. If you have gained or lose 10 pounds, have a baby or surgery on your abdomen or pelvis, you should be refitted because the size of the shape of the cervix and vagina may change. One size diaphragm must fit most cervixes. What are the possible risks and side effects of diaphragm? The use of diaphragm with spermicide can increase the risk of HIV infection, especially if both partners are at low risk. It may cause vaginal burning and irritation. Some may have allergic reaction. Additionally, the diaphragm may increase the risk of urinary tract infection or UTI, potentially leading to toxic shock and syndrome.
Lastly, cervical cup. The cervical cup is a small plastic dome that fits tightly over the cervix and it stays placed by suction. It acts as a barrier to keep sperm from entering the uterus. It should be used with the spermicide. A healthcare professional will fit in prescribe the cup. The type available in the United States comes in 3 sizes. The cup does not protect against STIs, including HIV. An external or internal condom should be used with the cervical cup to provide STI protection. What are the possible risks and side effects? The use of cervical cup can increase the risk of HIV infection from an infected partner, especially if both of partners are at low risk. It's advised to avoid using the cup during menstruation.
Intrauterine devices or IUDs. The first is copper IUD or Paragard. Hormone-free, effective for 10 to 12 years. Paragard is an intrauterine device that can provide long-term birth control contraception. It's sometimes referred to as a non-hormonal IUD option. The Paragard device is a T-shaped plastic frame that's inserted into the uterus. Copper wire coiled around the device produces an inflammatory reaction that is toxic to a sperm and egg ova, preventing pregnancy. Second is hormonal IUD or Mirena Skyla Kylina. Progestin releasing, effective for 3 to 7 years. Mirena is brand name of a hormonal intrauterine device or IUD. A hormonal IUD is a type of birth control that's placed in the uterus and uses hormones to give long-term birth control. Birth control is also called contraception. The device is a T-shaped plastic frame. It releases a type of the hormone progestin. To prevent pregnancy, Mirena thickens mucus in the cervix to stop sperm from reaching an egg or making it fertile. Things that lining of the uterus and partly stops the release of an egg. The release of the egg is called ovulation.
The first permanent method is vasectomy. It is a mere sterilization. Vasectomy is a form of male birth control that cuts the supply of sperm to your semen. It's done by cutting and sealing the tubes that carry sperm. Vasectomy has a low risk of problems and can usually be performed in an outpatient settings under local anesthesia. Before getting a vasectomy, you need to be ascertain you don't want to be a father, a child in the future. Although vasectomy reversal are possible, vasectomy should be considered a permanent form of male birth control. Second is tubal ligation. It is a female sterilization. Tubal ligation is a surgical procedure used as birth control for women. During the procedure, the fallopian tubes are tied, clamped, cut, banded, or sealed closed. This prevents an egg from moving from the ovary through the fallopian tube, where it could meet sperm and prevents sperm from traveling up to the tube to meet the egg, preventing pregnancy.
3 types of family planning. First, spacing births, having children at least 2 years apart to ensure proper care and resources. 2. Limiting family size, deciding on the number of children you want and using contraceptions to prevent additional pregnancy. 3. Delaying first pregnancy, postponing the first pregnancy until you're emotionally, financially, and physically ready. Importance of family planning. First, improve health outcomes, reduce the risk of maternal and infant mortality. Second, economic benefits, allows the better resources, allocation, and financial stability. 3. Increase education and career opportunities, enables individuals to pursue their goals and aspiration. 4. Reduce poverty, helps break the cycle of poverty by reducing the numbers of dependents.
Effectiveness rates. Hormonal methods 91 to 99%. Barrier methods 70 to 95%. IUDs 95 to 99%. Permanent methods 100%. Natural family planning 95 to 99%.
Important considerations. First is to consult a healthcare provider for personalized recommendation. Second is consider effectiveness, side effects, and lifestyle. Third is combined methods for enhanced protection. Fourth, regularly check expiration dates and replace devices. Lastly, ensure proper use and maintenance.